Ever get the feeling that there are entire worlds happening all around us that we can't even see? Invisible forces shaping our lives.
It's incredible when you stop to think about it.
It really is. And that's kind of the spirit of what we do here on the All Sorts podcast. It's all about opening up those hidden worlds and exploring them together. So welcome, everyone. Get ready for another deep dive. This time, we're going microscopic.
Really microscopic.
You know it! And to make this deep dive even more awesome, we've got all sorts of visuals and extras on our YouTube channel. So if you're more of a visual learner, head over there and subscribe. You can catch up on our past explorations too.
We've got a whole archive of deep dives waiting for you.
And don't forget to join the conversation on X, Instagram, and Threads. It's where we connect with you all and keep the discussion going. But for now, let's focus on today's topic, MRSA.
Methicillin-Resistant Staphylococcus aureus.
Yeah, that's a mouthful. But don't worry, we're going to break it down. We've pulled together info from some of the top sources out there, like the NHS, CDC, the Mayo Clinic, Healthline, Penn Medicine, even the Cleveland Clinic, and Medical News Today, and patient.info, too.
We've done our homework.
Absolutely. And our goal is to help you understand MRSA, what it is, how it spreads, what to look out for, how it's treated, and most importantly, how to prevent it.
We're giving you the knowledge without the scary medical jargon.
Exactly. So let's jump right in. What exactly is MRSA? It sounds kind of intimidating.
It does, doesn't it?
Yeah.
But really, MRSA is just a particular type of bacteria called Staphylococcus aureus. We often just call it staph for short.
Staph, like the stuff some people have on their skin.
That's right. About 1 in 3 people carry staph on their skin or in their noses. And usually it doesn't cause any problems. It's just kind of hanging out there.
So why all the fuss about MRSA then? If it's just regular staph, why is it a big deal?
Well, the thing that makes MRSA different is that it's developed resistance to certain antibiotics.
Ah, so it's like tougher to kill.
Exactly. Especially antibiotics like methicillin, which is where the MRA key in MRSA comes from. You see, these antibiotics normally work by attacking the bacteria and stopping it from growing.
Yeah.
But MRSA has found ways to protect itself. It's like it's built up a shield against our weapons.
So it's kind of like a superbug.
Yeah, people often call it that because it's much harder to treat with the usual antibiotics.
Okay, so now that we know what MRSA is, how does it actually spread? Like, how do we get it?
Well, the main way MRSA spreads is through direct contact.
Direct contact.
Like skin-to-skin contact with someone who has the bacteria.
Okay, so like shaking hands or hugging.
Yeah, it could be. But it could also be from touching things that have MRSA on them, like towels, sheets, clothing, even things like wound dressings.
Oh, wow. I didn't think about that.
Or things like razors or athletic equipment. If someone with MRSA uses them, and then you do, you could pick up the bacteria. And here's the thing. Some people can carry MRSA without actually having an infection.
Wait, what? So they have it, but they're not sick.
Yeah, it's called colonization. The bacteria is there, but it's not causing them any problems.
But they could still spread it to others.
Exactly. It's why hygiene is so important, even if you feel perfectly healthy. And there are actually 2 main types of MRSA that we talk about, HA-MRSA and CA-MRSA.
HA-MRSA, what's the difference?
HA-MRSA stands for Healthcare-Associated MRSA. It's the kind you might pick up in a hospital or other healthcare setting.
Ah, so it's more common in places where people are already sick.
Right. It often spreads through things like medical devices or contaminated surfaces, whereas CA-MRSA stands for Community-Associated MRSA. It's the kind that spreads through close contact outside of healthcare settings.
So like in schools or gyms or even at home.
Exactly. And it's spread through things like sharing personal items or through skin-to-skin contact, especially in places where people are close together, like locker rooms or sports teams.
Got it. So it's good to be aware of both types and how they spread. But how would you know if you actually have a MRSA infection? What are the symptoms?
Well, the symptoms can vary depending on where the infection is and how serious it is.
So different parts of the body, different signs.
Right. But the most common type of MRSA infection is a skin infection.
Okay, so what does that look like?
Well, it often starts as a painful, swollen area on the skin. It might be red or discolored.
So kind of like a big, angry pimple?
Sort of. It might feel warm to the touch and could even look like a boil or an insect bite.
Oh, yuck.
Sometimes it'll have pus or other drainage coming from it, and if it gets really bad, it could turn into a hard lump with a white or yellow center.
That sounds pretty nasty.
Yeah, and if you see redness spreading around the area, it could be a sign that the infection's getting worse.
That's a little scary.
It's definitely important to get it checked out if you see anything like that. But it's not just skin infections we need to worry about.
Oh, so it can affect other parts of the body too.
Yeah, if MRSA gets into your bloodstream, it can spread to other organs and cause more serious infections.
Like what? What kind of infections?
Well, it could cause pneumonia, which is a lung infection. It could infect your bones or joints. It could even lead to sepsis, which is a life-threatening condition.
Wow, that's serious.
It is. So it's important to be aware of the signs of a more serious MRSA infection.
Okay, so what are those signs? Like, what should we look out for?
Well, you might have a high fever and chills. You might have trouble breathing. You might feel really tired and weak.
And these would be on top of the skin infection.
It's possible, yes. But sometimes those skin symptoms might be subtle, especially on darker skin tones. So any unexplained fever, chills, chest pain, dizziness, those are all reasons to seek medical attention, especially if you know you've been exposed to MRSA or have any risk factors.
Risk factors. So are some people more likely to get MRSA than others?
Yeah, definitely.
Like who?
Well, for HA-MRSA, people who have been in the hospital recently are at higher risk.
Makes sense. They're around more sick people.
Right. Especially people who have had surgery or who have medical devices like catheters or IV lines. People with weakened immune systems are also more vulnerable.
So their bodies might not be as good at fighting off infections.
Exactly. And then for CA-MRSA, athletes are at higher risk, especially those who play contact sports.
Oh, yeah, because of all the skin-to-skin contact.
Exactly. And people who live in crowded conditions, like military barracks or dormitories, are also more susceptible. Sharing personal items like towels or razors can also increase your risk.
So basically, anything that involves close contact with others or their belongings.
Right. And also, people who inject drugs are at increased risk.
Because of the shared needles.
Yes, and potentially from skin infections caused by injecting.
Okay, so lots of potential risk factors there. But let's say someone does have a suspected MRSA infection. How do doctors actually diagnose it?
Usually it starts with a physical exam. The doctor will look at the affected area and ask about your symptoms.
So just looking at it isn't enough.
Not always. They might need to take a sample of the infection to test it.
A sample, like a swab.
Exactly. They might swab the wound, or if they think you might be a carrier, they might swab your nose. And they might take blood or urine samples too, depending on the situation.
Okay, and then what? What do they do with those samples?
They send them to a lab where they can grow the bacteria and figure out what kind it is. They'll test it to see if it's resistant to methicillin and other antibiotics.
So they're basically seeing which antibiotics work against it.
Right. That way they can choose the right treatment.
Speaking of treatment, how do you actually treat MRSA?
Well, luckily, there are still antibiotics that work against MRSA.
Oh, that's good news.
It is. But the doctor needs to choose the right antibiotic based on the lab tests.
So they can target it specifically.
Exactly. For mild skin infections, they might prescribe antibiotics you take by mouth or even a topical cream you put directly on the skin.
So sometimes it can be treated at home.
Yes, sometimes. But if it's a more serious infection, you might need to go to the hospital and get intravenous antibiotics.
IV antibiotics.
Yeah, the antibiotics are delivered directly into your bloodstream through a vein.
That sounds pretty intense.
It can be. And sometimes if there's a boil or abscess, the doctor might need to drain it.
Drain it.
Yeah, it might not be pleasant, but it's important to get the pus out to help the infection heal.
Okay, so treatment can range from simple creams to hospital stays and IV drips.
Right. And one really important thing to remember is that you have to take all of your antibiotics exactly as prescribed.
Even if you start feeling better.
Especially if you start feeling better. If you stop taking the antibiotics too soon, the infection could come back, and it could be even harder to treat the next time.
So it's really important to finish the whole course.
Absolutely. It's crucial to follow your doctor's instructions.
Okay, so we've talked about what MRSA is, how it spreads, the symptoms, how it's diagnosed, and how it's treated. But what about prevention? Is there anything we can do to protect ourselves from getting MRSA in the first place?
Definitely. There are actually a lot of things we can do.
Like what?
Well, the most important thing is hand washing.
Okay, so good old hand washing. How long should you wash for?
At least 20 seconds with soap and water. Make sure to lather up really well and get all the surfaces of your hands, including your nails.
20 seconds, got it.
And if you don't have soap and water, you can use an alcohol-based hand sanitizer.
Like the stuff we all carry around now.
Yeah, exactly. It's not as good as soap and water, but it's better than nothing.
Okay, so hand washing is key. What else?
Well, it's important to keep any cuts or scrapes clean and covered with a bandage,
Even little ones.
especially little ones. It's a way for bacteria to get into your body.
Makes sense.
And you should avoid sharing personal items like towels, razors, and athletic equipment.
Okay, so no borrowing your friend's razor?
Nope. And if you play sports, make sure to shower right afterwards.
Good hygiene in general, basically.
Right. And if you're in a healthcare setting, make sure to follow their hygiene guidelines. They might have specific rules about hand washing and wearing gloves or masks.
So it's really about being aware and taking precautions.
Exactly. And the good news is that these simple steps can really make a big difference in preventing MRSA infections.
So we have the power to protect ourselves and others.
Absolutely.
Well, this has been an incredibly informative deep dive. I feel like I've learned so much about MRSA.
Me too. It's amazing how much there is to know about this tiny little bacteria.
And it's empowering to know that we can take steps to protect ourselves. So, for all of you listening, remember, MRSA is out there, but it's not something we have to be afraid of.
We just need to be informed and take precautions.
Exactly. And if you want to learn even more, check out our YouTube channel. We've got videos and extra content to help you visualize everything we've talked about today.
And don't forget to subscribe.
Yes, subscribe to the All Sorts podcast on YouTube.
Yeah.
And while you're at it, give us follow on X, Instagram, and Threads.
We love hearing from you.
We do. And be sure to check out our archive of past deep dives.
There's something for everyone.
There really is. So until next time, stay curious, stay informed, and stay healthy.
And remember, the world is full of fascinating things, even the ones we can't see.
See you next time.